They were on the front lines a year ago when COVID first hit, and now healthcare workers are among the first to receive the COVID vaccine. Being first is usually a good thing, but as you're about to find out, some healthcare workers are perfectly fine with being last in line for the shot.
So anytime that you kind of have that special access to something, you get that excitement. And then I kind of started thinking about it, and I have multiple reasons why I chose to decline.
Elizabeth Jaeckle is an acute inpatient physical therapist at a hospital in Washington, Missouri. She has treated a number of COVID patients and has seen the impact of the virus firsthand. Still, when she got the email to sign up for her COVID vaccine, she wasn't sure.
I don't like to be the first to do anything.
And she isn't alone. 5 on Your Side reached out to our area hospitals to find out how many healthcare workers have received the vaccine. 64,709 task force hospital healthcare workers have received their first dose. That number is expected to increase as confidence grows. According to their records, about 64% of employees wanted to get the vaccine, which leaves roughly 40% unvaccinated.
No, I'm not terribly surprised.
Dr. Shefali Wolf is the Assistant Medical Director for Infectious Disease at SSM Health.
We've been fighting kind of this uphill battle with COVID disinformation for the past year, and that, of course, has spilled over into the vaccine as well.
Dr. Wolf has had both doses of the vaccine and witnessed the hesitation among her colleagues.
There were people who initially in the first week said, I'm going to wait a couple of weeks. I'm going to kind of watch the people in my unit get the vaccine and see how they do.
Dr. Wolf says while the vaccine is new, the technology isn't. mRNA has been around for 10 years.
And the data that we have so far, the vaccine really seems very safe when we're using it in the real world, not just in the clinical trials.
Still, Jaeckle says as a healthy young adult, she'd prefer to wait and give others who are high risk her spot in line.
Let them go before me. That's kind of what I think.
It is important to note that because the COVID vaccine is not yet FDA approved, hospitals are not making it a requirement like the flu shot.